You know that feeling. It starts in your lower back. It is not exactly pain at first, just a tightness. Something is just waiting to happen. Then it shoots down, through your hip, along the back of your thigh. Sometimes it goes all the way down to your calf. Sometimes an entire area goes completely numb. Sometimes it feels like someone is jabbing an electric wire right into it. You know exactly which posture triggers it. You know which chair in your house you cannot sit in for more than 20 minutes. You know that standing up after sitting for a long time is the exact moment you have to hold your breath and brace yourself. And you have been living with it, maybe for months, maybe for years now. You have gone to the doctor. You have had an MRI. The doctor points at the film and says it is a disc issue, a herniation, or a pinched nerve. This is why you are in pain. And maybe you have done physical therapy. Maybe you have taken pain medications. Maybe you have tried spinal decompression, massages, acupuncture, or even injections. It gets better for a little while, and then it comes right back. Then it comes right back. Then it comes right back. If you are watching this video, I know you are tired of that endless loop. And I want to tell you this right now. Before we even begin, you are not imagining it. That pain is real, and the reason it never truly goes away is also real. It is just that nobody has enough time in the clinic to explain it to you. Today, I am going to do just that. Your disc might be part of the problem. I am not denying that. But it is not the reason your sciatica keeps coming back. The real reason lies somewhere else entirely, a place that an MRI does not show, and most treatments never even touch. Once you understand that spot, you will see why everything you have tried before only treats the symptoms. And I am going to give you 3 specific exercises to start changing that, starting tonight. Let me show you what is actually going on inside your body. The sciatic nerve is the longest nerve in your body. It starts in your lower back, runs deep down through your hip, along the back of your thigh, branches out around the knee area, and goes all the way down to your foot. That entire journey goes from your back down to your toes. Now, think of this nerve like a long electrical wire running through multiple rooms in a house. If that wire gets stuck somewhere, if it gets pinched, glued to the wall, or pressed down at some point along the way, then even if you fix one pinch point, the other spots will still cause trouble. The lights will still flicker. The signal will still be disrupted. Most sciatica treatments focus on only one spot, the spine. But the sciatic nerve can get trapped at many different places along that entire journey. And the most common trap after the age of 60, the one most people do not know about, is not in the spine. It is deep inside your hip. Located deep beneath your glute muscles is a small, triangular muscle. The scientific name is the piriformis muscle, and the sciatic nerve passes right underneath it, or in some people, straight through the middle of it. After the age of 60, especially if you sit a lot, this muscle becomes chronically tight and shortened. It squeezes the sciatic nerve like a hand gripping a rope tightly. You stretch your back, but that hand is still there. You get an MRI, but that hand does not show up on the film. You treat the disc, but that hand keeps squeezing, and the pain keeps coming back. But there is another thing that happens over time that most people do not know about. A healthy nerve does not stay still. It glides and moves inside the nerve pathway every time you move. Think of it like a noodle inside a straw. When the straw is straight, the noodle glides freely back and forth. When the straw is bent or squeezed, the noodle gets stuck. When a nerve is compressed or inflamed for a long time, the surrounding tissues start to stick together. The nerve loses its ability to glide freely when you move. As a result, every movement ends up tugging on the nerve instead of letting it slide through, and the pain flares up again. These 2 problems, the tight piriformis muscle squeezing down and the nerve losing its ability to glide, are the reasons why chronic sciatica after the age of 60 never truly goes away with just spinal treatment alone. Today I have 3 exercises for you. Not 3 typical stretches. These are 3 exercises specifically designed to target the exact 2 issues I just described: releasing the piriformis muscle and restoring the free gliding ability of the nerve. The second exercise, the nerve gliding technique, is the one I want you to pay close attention to. Most physical therapists know about it, but most patients are never shown how to do it. You do not need to get down on the floor for any of these. You just need a chair and a bed. Stay with me until the end, because the third exercise is the game changer for the most chronic cases. Exercise number 3. I call it the figure 4 release. This is the exercise that directly targets that hand squeezing your nerve. The piriformis muscle cannot be stretched with typical back stretches. It is just too deep. This exercise approaches it from a completely different angle, through the hip. Sit up straight in a chair. Place both feet flat on the floor. Now, take your painful leg and place the ankle of that leg onto the knee of your other leg. Your leg forms the shape of a number 4. That is it. The first stage is to just sit in that position for 30 seconds. You do not need to do anything else. The gravity of your leg is already starting to gently stretch the piriformis muscle. You will feel a deep pressure inside your glute, not pain, just a deep stretch. That is exactly where you want to feel it. Stage 2 is to place one hand on the knee of your crossed leg. Gently press down, not hard, just enough to add a little more pressure. Hold for 20 seconds. Breathe out slowly as you press. Do not hold your breath. Stage 3 is keeping that figure 4 shape. Slowly lean your torso forward as if you are bowing to someone. Keep your back straight. Do not slouch. You will feel the piriformis muscle stretch from a completely different angle compared to the first 2 stages. Hold for 20 seconds. If your leg cannot reach your knee, simply place your ankle on your shin instead of your knee. It gives the same effect, but at a more comfortable angle. Do not force your body into a painful position. Do this 3 times on each side. Always start with the painful side. Do this twice a day, in the morning and at night. Before we get to the most important exercise, if this is making sense to you, please hit the like button right now. It helps other people over the age of 60 who are looking for this exact information find this video. Exercise number 2. I call it the nerve gliding technique. This is the one I want you to understand the most, because this is something most people with sciatica have never been shown, and it directly addresses the second problem I described: the nerve losing its ability to glide freely. Remember the image of dental floss. When you floss, you slide it back and forth gently to clear out the tight spots. This is exactly what you are doing with your sciatic nerve. You are teaching it how to glide again. Sit up straight on the edge of your chair. Lightly hold the sides of the chair for stability. Keep your back straight. Movement 1 is to simultaneously straighten your painful leg out in front of you and look up at the ceiling. These 2 movements at the exact same time stretch the nerve from both ends. Movement 2 is to simultaneously bring your leg back down under the chair and tuck your chin down toward your chest. These 2 movements at the exact same time reduce the tension on the nerve from both ends. Now alternate between those 2 movements slowly and continuously, just like you are swimming. No jerking motions. Do not stop in any position. Just glide back and forth, 1 beat every 2 seconds. Going slow is much more important than doing a lot of repetitions. I need to tell you this: if you feel your pain increase while doing this, stop immediately. That means the nerve is still in an acute inflammatory stage and is not ready for this exercise yet. Just stick to exercise number 3 for a few days before coming back to this one. The correct feeling is a gentle stretch in the back of your thigh, not pain. If you only feel a stretch in the back of your thigh, you are doing it completely right. 10 times on each side, once a day. No more than that, because with this technique, more does not mean better. And now for the exercise I promised right from the beginning, the one for the most chronic cases. Exercise number 1. I call it the deep hip activation. This one combines both, releasing the piriformis muscle and reactivating the gluteus medius, the muscle that most people with chronic sciatica have not used correctly for years. Lie flat on your back on the bed. Bend both knees and place your feet flat. Place your arms along the sides of your body. Stage 1 is to cross the ankle of your painful leg over the knee of the other leg, forming a figure 4 shape, this time while lying down. Use both hands to grasp the thigh of your non-painful leg. Gently pull both legs toward your chest. Hold for 30 seconds. Breathe evenly. You will feel a deep, spreading pressure inside the glute of your painful side, much deeper than when sitting. Stage 2 is to return both feet to the starting position, feet flat, knees bent. Now slowly lift your hips off the bed. You do not need to lift them high, just enough to form a straight line from your shoulders to your knees. Squeeze your glute muscles tight at the top of the movement. Hold for 3 seconds. Lower down slowly. The most important thing is that you must feel your glutes working, not your lower back. If you feel your lower back straining, lower your hips a little bit. This exercise is about the glutes, not about how high you can go. I want to pause here for a second, because what I am about to tell you is something I wish I could have told every single one of my patients sooner. In my 20 years of working with sciatica patients, I have noticed one thing over and over again. Most people with chronic sciatica over the age of 60 share a common trait. Their glute muscles have stopped working properly. It is not because of muscle weakness. It is because years of heavy sitting have caused the brain to gradually stop sending the correct signals to the glutes. The muscle is still there, but the neural connection has weakened. As a result, the piriformis muscle, that tiny muscle deep inside the hip, has to compensate for the work the glutes are supposed to be doing. It gets overloaded, it tightens up, it squeezes the sciatic nerve, and the pain never stops. This exercise does not just release. It retrains the glutes on how to work, and when the glutes start functioning properly again, the piriformis muscle no longer has to carry the extra load. That squeezing hand gradually lets go. 10 repetitions, twice a day, in the morning before getting out of bed, and at night before going to sleep. There is one more thing before we wrap up, and this surprises most of my patients. Number 1. Your sitting posture dictates 80% of your recovery speed. All of these exercises will lose their effectiveness within 24 hours if you keep sitting incorrectly. Simplest adjustment you can make today is to roll up a small towel or use a small pillow placed behind your lower back when you sit, right at the natural curve of your lumbar spine. This keeps the spine in a neutral position and prevents the piriformis muscle from being constantly compressed. And for every 30 minutes of sitting, stand up for 2 minutes. Not to exercise, just to release the accumulating pressure. Number 2. Heat before exercise, cold after acute pain. Many people do the exact opposite and do not understand why the results are not what they expected. Applying heat for 10 minutes before doing the exercises helps soften the piriformis muscle, making it easier to release. But if you have just experienced a flare-up of acute pain during the first 48 hours, ice is the correct choice. Cold reduces inflammation. Heat during an acute inflammatory stage makes the condition worse. Number 3. Here is a simple test to see if you are progressing. 2 weeks after starting these 3 exercises, sit down in a chair. Straighten your painful leg out in front of you, and slowly flex your foot back toward your shin. If you feel less numbness and less pain than you did 2 weeks ago in that exact same position, your nerve is learning how to glide again. That is the sign you are on the right track. Here is the daily routine. In the morning, before getting out of bed, Do stages 1 and 2 of the deep hip activation exercise 10 times. During the day, every 30 minutes, stand up for 2 minutes and check your back pillow. In the evening, while sitting in a chair, do the figure 4 release 3 times on each side, followed by the nerve gliding technique 10 times on each side. Before going to sleep, do the deep hip activation a second time. The total time is under 15 minutes a day. If you are in an acute pain stage, just start with the figure 4 exercise and add the nerve gliding technique once the pain has subsided. Print this out, tape it to your nightstand. Consistency during the first 3 weeks is more important than any single exercise. I want to ask you a question, and I read every single's response. Has your doctor ever mentioned the piriformis muscle or the nerve gliding technique? Let me know in the comments section. Your answers will help me know which area to dive deeper into for the next video. If today is the first time you understand why your sciatica keeps coming back, please subscribe to the channel. Every week, I share evidence-based information from 20 years of treating patients. There is nothing to sell, just things that actually work. Move well, age well. I will see you in the next video.